So, a lot of women do experience anxiety either during pregnancy or after having given birth. More specifically, we know that about 6% of women during pregnancy and about 10% of women after having given birth experience anxiety. They may experience it alone, but also a lot of women experience anxiety along with depression. In addition, if you are someone who has experienced anxiety earlier in your life, it's important to know that you are at risk for the anxiety returning either during pregnancy or again after having given birth. There are a number of symptoms that go with anxiety. You do not need to have all of the symptoms in order to have anxiety. The symptoms you might experience are racing thoughts, the thought or the sense that something bad's going to happen, constant worrying. You might also feel a sense of restlessness, difficulty sleeping, poor appetite. Your body may respond to the anxiety with a sense of dizziness or discomfort, a fidgetiness, and you may also feel fatigue from all the anxiety and the worry. With anxiety, there's different kinds of anxiety. So two specific kinds that you might want to be aware of are panic disorder as well as obsessive compulsive disorder. So people who have panic disorder, they have these panic attacks. Your heart beats fast, you may have trouble breathing, get short of breath, you're afraid you're going to have a heart attack or you're going to die. It's really that overwhelming. And that's not unusual for people to feel. And what happens with panic attacks is that they hit hard, but then they just pass. If you could just know that, okay, this is just a panic attack, you'll be okay. You're not having a heart attack, you'll survive. Then the panic attack does just fade on its own. Another type of anxiety you might experience is obsessive compulsive disorder. So obsessions. Women with a newborn often have obsessions like they're afraid of germs. They're afraid their baby's going to get sick. The baby's going to get hurt. They may have obsessions about harming their baby. It's very important to know that if you have these kinds of obsessive thoughts, thinking is very different from action. And in fact, if the thoughts really upset you, then you're really not likely to act on it. It's just disturbing to have the thoughts. Obsessive compulsive disorder, so the compulsion piece. Compulsions are where you do a behavior again and again. So you might keep checking on your baby, making sure your baby's still breathing or your baby's still okay, and just even when you know it's okay, you just have to keep going back and checking. So that's the compulsions in obsessive compulsive disorder. Both of these disorders are definitely treatable. You just need to find a therapist who can help you. So there are a couple of really common risk factors. One that you want to look at is thyroid problems. Your doctor can just check to see if there's an issue with your thyroid, because a hyperactive thyroid can lead to a lot of anxiety. In addition to that, having a personal or family history of anxiety puts you at risk for having anxiety during pregnancy or after having given birth. So you want to take a look at your family tree, your parents, siblings, aunt, uncle, and whether they were diagnosed with an anxiety disorder or you know that they really struggled with it just from watching them. Those things would put you at risk. As well as, again, if you have struggled in your life with anxiety before, then that puts you at risk during pregnancy or after having given birth. If you think that you are struggling with anxiety, then it would be important to get some help with that. There's a lot of different options. You might just get more educated. Just as you're watching this video, you might find other videos. Postpartum Support International has a wonderful website with all kinds of information. But just make sure whatever education information you're getting, it's coming from a reputable source. In addition, you might join a support group where you get the help of other women going through these kinds of struggles. Or you might turn to therapy. Individual therapy to help you internally with how to work with or overcome your anxiety, as well as couples therapy. If you have a partner and the two of you are struggling together, or your anxiety seems to be getting in the way of working together, so different reasons to come together as a couple and get that couples therapy, alone or with the individual therapy. Medicine might be something that can be very helpful for you. A lot of women don't want to look at medicine because they're afraid if they're pregnant or they're breastfeeding that it's not okay. And I would say just don't presume that. You want to talk with a physician who understands the way medicine works and what medicines might be okay during those times. If you're struggling and you're really not sure what kind of help you need, I suggest that you reach out to your doctor. If you have a therapist, reach out to your therapist. Get on Postpartum Support International. They have a number you can call where you can get some direction. But turn to some professional who can just advise you and guide you to get you the help that you need.